Hepatitis continues to be a huge public health problem in the Philippines. In fact, hepatitis B affects 7.3 million adult Filipinos today. And many don't even know they have it. Hepatitis is a general term that refers to the inflammation of your liver, a vital organ that processes nutrients, filters blood, as well as fights infections. Fortunately, most types of hepatitis can be prevented with awareness and proper care. I'm Dr. Freddy Gomez. Welcome to MedTalk Health Talk on CNN Philippines. Hepatitis quietly damages the liver with mild to little or no symptoms at all, and sometimes even leading to liver cancer or cirrhosis. With us is Dr. Janus Ong. He's a hepatologist and consultant at the Center for Liver Health and Transplant of the Medical City. We're also joined by Dr. Edmir Macabulos. He's an occupation and public health specialist and the immediate past president of the Philippine College of Occupational Medicine. Thank you both for joining us on the program today. Now, hepatitis is an inflammatory condition of the liver, and it's usually caused by a viral infection. I'm sure you've all heard of hepatitis A, hepatitis B, and maybe even hepatitis C. But there are actually other possible causes of the disease. Dr. Ong, can you tell us more about hepatitis as well as what causes this?
Well, hepatitis, as you said, is inflammation of the liver o yung pamamaga ng atay. And there are many causes. There are viral causes, as you already mentioned, well known to us are hepatitis A, B, and C. But there are also non-viral causes of hepatitis. These include alcohol abuse, medication use. Some medications can cause hepatitis, and there are autoimmune diseases that can cause hepatitis.
Yes, that's true. And it's also good to remind everyone, as mentioned, that excessive alcohol consumption can cause irreparable liver damage. Dr. Edmir, could you please expound more on this?
Basically, alcohol in itself is a toxic agent. So heavy drinking over many years can lead to alcoholic hepatitis, causing inflammation of the liver because of alcohol intake. Aside from the effect of alcohol in itself, there could be some interaction that can also result in damage of the liver.
There are other toxic causes of hepatitis, which include the overuse of certain medications and exposure to certain toxins or poisons. Now, in the onset of hepatitis, symptoms may or may not develop, but ultimately the liver reacts in different ways. Aside from the symptoms, your doctor will be able to diagnose hepatitis through a few tests, and he'll most likely start by taking your history and conducting a physical exam. Now, Dr. Edmir, how can a doctor tell that you might have hepatitis through a physical exam?
It's very difficult at the early stage. It's not very obvious. Since this is the infectious type, you will have some kind of fever, flu-like symptoms, but eventually, if it becomes full-blown, you can even develop yellowing of the skin, such as jaundice, and even the liver can also enlarge.
Now, if your doctor notices some physical warning signs like an enlarged liver as well as yellowing of the eyes, he'll then run probably a liver function test. Now, Dr. Ong, what is a liver function test and what is the doctor trying to look with the results of these?
Well, what we know about liver function tests is mainly a battery of tests, blood tests that includes ALT or SGPT, AST or SGOT, bilirubin, alkaline phosphatase. So these are tests that that the doctor will conduct in order to figure out if there is inflammation of the liver, and more importantly, for the other tests such as bilirubin, whether the liver is still functioning well.
Okay, now sometimes imaging studies like ultrasounds or CT scans as well as much as a liver biopsy may also be used. Dr. Ong, when will the doctor recommend these tests?
I think most will order an abdominal ultrasound or a liver ultrasound, especially if the abnormality is one that involves the bilirubin. But for ALT or AST elevations, usually the diagnose na yan ng mga other blood tests, including yung test po sa hepatitis. Liver biopsy, we do that only if we do not know the reason of the hepatitis based on the blood test examinations and the ultrasound.
Now again, non-viral hepatitis can be caused by alcohol consumption, medication, drugs, or even toxins. So if you're diagnosed with this type of hepatitis, your doctor will administer treatment right away. Now, non-viral hepatitis can lead to scarring on the liver or liver cirrhosis, which can even lead to liver cancer and liver failure if not treated early. Dr. Ong, what treatment is usually prescribed for this type of hepatitis?
For any hepatitis, actually, for that matter, we will need to first figure out what the cause of the hepatitis is. So for the non-viral hepatitis or the types of non-viral hepatitis, such as alcohol or medication-related hepatitis, the main treatment is actually avoidance of alcohol, or so complete abstinence from alcohol. And for medication-related hepatitis, the avoidance or the discontinuation of the medications. For most patients, when you stop alcohol use or you stop medication use, which was the one causing the hepatitis actually improves and resolves.
Now, if your hepatitis is caused by excessive alcohol consumption, you need to stop drinking completely to keep the disease from progressing or getting worse. When we return, we'll discuss the causes of viral hepatitis, its symptoms, and the vaccines available. Again, hepatitis is a public health problem in the country, and taking action against the disease begins with awareness. Stay with us here on MedTalk Health Talk. We're your partner in healthcare. This is CNN Philippines. I'm Dr. Freddy Gomez, and this is MedTalk Health Talk, where your healthcare comes first. The World Health Organization reported that an estimated 4.5 million premature deaths were caused by hepatitis could be prevented in low and middle income countries by 2030. This can be done through vaccination, diagnostic tests, medicines, and of course, education campaigns. Now, we've learned that hepatitis is usually caused by a virus, also called viral hepatitis. And the most common types include hepatitis A, B, as well as C. Dr. Ong, let's explain these.
They're actually different viruses. They cause the same symptoms, actually. So let me just make sure that I mentioned that hepatitis A, B, and C have an acute infection, but only hepatitis B and C have a chronic infection. By chronic infection, I mean that when the patient gets infected, they will actually carry the virus all of their lives unless the virus is treated.
While all types of viral hepatitis are infectious, we need to focus on protecting ourselves against hepatitis A, B, and C. First, hepatitis A is, for the most part, found in low and middle income countries. And because of our reduced access to clean and reliable water sources and increased risk of contaminated food. Dr. Edmir, how does hepatitis A primarily spread? Paano ba ito kumakalat?
Hepatitis A virus is usually spread through the fecal-oral route. It may be spread when an uninfected an unvaccinated person ingest food or water that is contaminated with the fecal material, yung feces o yung dumi or pupo ng tao of an infected person. So the disease is closely associated with unsafe water or food, inadequate sanitation, and even poor personal hygiene, and as well as oral anal sex. That's for hepatitis A. If we talk about hepatitis B, which is a little different with regards to transmission, hepatitis B is most commonly spread through vertical transmission. That's one way of transmitting it. That is from the mother to the child at birth, perinatal transmission, and through horizontal transmission, which is the exposure of a person to the infected blood, such as spread by needle stick injury, tattooing, body piercing, And as mentioned, exposure not only to blood, but infected body fluids as well, seminal fluids. Thus, sexual transmission of hepatitis B may also occur.
Lastly, hepatitis C is one of the more serious types of hepatitis. The World Health Organization reported that 6 in 1,000 Filipinos have had hepatitis C in 2019. Dr. Ong, can you tell us more about hepatitis C and how big of a concern this is?
Well, hepatitis C is, as you said, another infection that can cause both as an acute and a chronic infection. It is also transmitted through blood and body fluids, pretty much the same as hepatitis B. As you said, it affects about 0.6% of Filipinos. That's about 600,000 Filipinos in 2017 when we did our modeling study. Similar to hepatitis B, a proportion of patients can go on to progress and develop liver cirrhosis and liver cancer. Maybe about 30% of patients will go on to develop this progressive liver disease.
Now, for hepatitis A, B, and C, and even D or E, symptoms usually range from mild to none. But each form of the virus can cause more severe symptoms. Dr. Ong, what are some of the warning signs of, let's mention all of it, starting from hepatitis A, B, and C?
Well, for hepatitis A, B, and C, during the acute infection, the warning signs would be jaundice, confusion or mental confusion that would indicate that the patient has very severe liver disease and may actually be developing acute liver failure. For chronic infection with hepatitis B and C, the warning signs would be the development of muscle wasting or muscle loss, appetite loss, also jaundice, or increasing abdominal distension, because that would indicate the accumulation of fluid in the abdomen. And all of these are signs of progressive cirrhosis as well as liver failure.
Now today we have vaccines available for hepatitis A and B. And these vaccines are crucial because they protect against serious illness and sometimes even death. Dr. Ong, please remind our viewers again, why do we need the hepatitis B vaccine? What should they know about it?
Well, it is mandatory, as you mentioned. It's by law. Hepatitis B vaccination at birth is mandatory for all infants born in the Philippines. And it is recommended that the vaccination for hepatitis B be given within 12 to 24 hours of birth. And that is regardless of whether the mother is hepatitis B positive or not. So all infants should be vaccinated. So I encourage all parents, not just the mother, because they would probably not remember these things when they just gave birth, but maybe the parents and the grandparents, to make sure to ask if the hepatitis B vaccine has been given to the baby within 12 to 24 hours of birth. So that's very important because it has been shown in huge studies from places where they're very successful in their infant vaccination program that vaccination against hepatitis B during infancy prevents liver cancer as well as liver cirrhosis.
Okay, so very good information there. Now, Dr. Edmir, how about the Hepa A vaccine? When is it recommended? Sino ba yung mga dapat kumuha nito?
Anyone traveling to or working in areas where hepatitis A is endemic or more widespread, people who have occupational risk for infection, such as those who whose work puts them in potential contact with hepatitis, those who have chronic liver disease, or any person wishing to obtain immunity for that matter.
Vaccines against hepatitis A and B save lives, but we still need to practice proper prevention. We'll discuss best practices against viral hepatitis and the treatments available after a short break. We want to be your partner for a lifetime of good health. Stay with us on CNN Philippines. Welcome back to Med Talk Health Talk. I'm Dr. Freddy Gomez. Today, we're talking about hepatitis, a public health problem here in the Philippines. And we all need to do our part to protect against the disease by getting the vaccine, practicing proper prevention, and seeking early treatment. Now, while hepatitis A is an infectious disease, it usually doesn't require treatment because it's, for the most part, short-term. Now, most hepatitis A cases are mild, with the majority of people recovering fully. Dr. Ong, what's recommended for those diagnosed with hepatitis A? What do you advise for them to do?
People get infected and they get over the infection. There's just a few, maybe less than 1%, who have very severe hepatitis A infection that go on to develop acute liver failure. So those individuals that fall into that less than 1% group should be referred to the hospital so they can be properly managed. But most patients will only require supportive management. Supportive management means making sure that they stay hydrated, that they have enough rest, and if they have flu-like symptoms, they can be given medications for muscle aches, headaches, as well as for fever.
Now, hepatitis B and C can sometimes lead to chronic liver disease, cirrhosis, and even liver cancer. Dr. Ong, how is chronic hepatitis B naman treated?
In the Philippines now, we have 3 drugs that are approved as first-line treatment for hepatitis B. I just want to emphasize that when we treat hepatitis B, they are very effective. We can lower the hepatitis B viral loads, and we can also, because we lower the viral loads, decrease inflammation, and in some cases even improve the liver function and reverse cirrhosis.
Dr. Ong, how about naman with hepatitis C? What are the options available with someone who is diagnosed with hepatitis C?
Yeah, with hepatitis C, it's a better picture for hepatitis C. We also have very effective treatments now. So right now we have available in the country a single pill or 2 pills that we can take for 12 weeks in most patients and 24 weeks for those who have severe liver disease.
Now, even with the vaccine, it's still important to practice prevention methods and reduce the risks of getting hepatitis in your day-to-day. Dr. Edmir, can you share with us some of the best practices to protect ourselves against hepatitis?
Okay. First things first, no? We mentioned about the transmission, how it is spread. So the basic there is to stop the transmission, the spread. So we have to know how it is being transmitted. With regards to hepatitis A, it is transmitted or spread because of contaminated food and water. So basically, we should practice good hygiene as a way of avoiding this type of hepatitis. Make sure, or huwag tayo yung tinatawag na mag-experimento with regards to food. Although I'm not saying that to eat street food, but make sure if you're going to try this out, yung maganda ang preparation, no? Also avoid, for example, eating raw or undercooked foods, more particularly shellfish, and some fruits and vegetables. So that's one way of preventing hepatitis A. With regards to hepatitis B, if you know you have some, if you're working or have high risk of contracting, but this is more particularly the healthcare worker, it's very, very important to follow the standard operating procedure, the protocol on how you can prevent. With regards to alcohol consumption for alcoholic hepatitis, we have to maybe try to drink in moderation. So basically, we should be aware of how it is spread, and then by knowing that, we can stop the transmission of these diseases.
Dr. Edmir, what are the ways naman that our viewers can take care of their liver in general?
Sabi nga natin, the liver, there are a lot of functions as far as the liver is concerned. So again, the liver is a cleaning organ, one of the cleaning organs of the body. So pag inabuso mo siya, like for example, eating too much fat, too much alcohol, and then combination of drugs, for example, we have to be conscious on what we're taking in, and of course, avoid toxic materials, exposure to chemicals, and ensure that we follow proper hygiene so that we'll be able to protect our liver. And of course, physical exercise.
Thank you very much, hepatologist Dr. Janice Ong and occupation and public health specialist Dr. Edmir Macabulos for sharing with us your expert insights. We hope our conversation today was very helpful to our viewers. I'm Dr. Freddy Gomez, and we'll see you again next time. Stay safe, everyone.